Hello everyone, hello Queensland, and I just want to give an update. Of course, we've only had one new case in hotel quarantine overnight, which is fantastic news, and we have 10 active cases, and people are getting tested, which is great to see. So over 4,000 people have been tested in the past 24 hours. So we want to keep that great record in Queensland, and if you have any symptoms, please go and get tested. Well, we just wanted to update everyone today in relation to the border closures, and I'll hand over to the Deputy Commissioner to talk a bit more in detail about that. But what we are seeing is people are breaching and are being turned around. So there will be a hard border closure that will be going in place. People will start to see barricades going up again this afternoon, and by 6 a.m. tomorrow it'll be back to the strong border measures that we have seen in Queensland that have kept Queenslanders safe. This is really important, everyone. We want people to do the right thing, so people will be turned around. But I do want to thank the Police Commissioner, the Deputy Commissioner briefed me just previously, and that's why we've taken this swift action today, because unfortunately people are doing the wrong thing and we can't risk it. The other message I wanted to give today too was just in relation to if anyone has travelled to Queensland from the Northern Beaches from the 11th of December, I'm asking you to please go and get a COVID test. We are concerned that there are people from the Northern Beaches who have travelled right around Australia. We believe that there are people here in Queensland. So what I'm saying to accommodation providers is you'll have a list and a register about who is staying in your premises. If they have come from the Northern Beaches, please put something under their door or talk to them about going and getting a COVID test. Likewise, if you have friends or family who have come to Queensland, we are asking them to also remind them to go and get a COVID test as well. We just want to do everything we possibly can to make sure that we do not get any community transmission here in Queensland. I want to thank everyone for doing the right thing. I know this is a very difficult time, and of course, being closed to Greater Sydney and the Northern Beaches, we do want to welcome those tourists back here to Queensland. You know, down the track, we do love you, but at the moment, if you can appreciate, it is a very hard and very difficult decisions that we're making, but we are making these decisions in the best interests of keeping Queenslanders safe. We also have a lot of visitors here at the moment as well, and we want everyone to be safe. So the Health Minister will talk a little bit more about the QR codes and the compliance there. But I want to hand over quickly to Dr Young. She's got to go to an AHPPC meeting, so we'll get her to do her briefing and any questions to Dr Young, and then the Deputy Commissioner will update everyone about the hard border closure that will be going into effect. Thank you, Dr Young.
So we have that one new case in Queensland, someone in hotel quarantine. Now, we've had one case associated with this growing cluster in the Northern Beaches who was here on the 16th and 17th of December. And please, anyone who was in the Glen Hotel on the 16th of December, could you please come forward and get tested? 560 people have so far, but we're not sure that everyone has come forward. That is critical. It's critical for you as an individual, but it's also critical for your family members and for the community. That's very important. Similarly, anyone who is in Queensland today who was in the Northern Beaches on the 11th of December or subsequent to that, it is really important that you also come forward and immediately make yourself known and get tested. That's critical. And I do thank all those people who have come forward. We are seeing very long queues at some of our testing facilities. If that happens, just go online and see where there are other facilities, because we have stood up a lot throughout the state. It is really important that anyone in Queensland with any symptoms immediately comes forward and gets tested. Don't think it's a sniffle or a cold. It could easily be COVID. That's unfortunate, but true. We have to go back to all of those processes we had in place earlier in the pandemic that stood Queensland so well. We've got through this before. I'm positive we'll get through it again because people know what to do. Now's the time to go and put all of that back in place. And please, whenever you go anywhere, and they need you to give your details, could you please make sure you give them? So we're introducing that mandatory QR code or electronic process, but it's just so important. Please give accurate details. It's so easy to get one number wrong in a mobile phone number. Just make sure it's correct, because that means we can very, very quickly get hold of everyone who's been in that facility. We won't be still trying to get people 5 days later, as we are with the Glen Hotel. So make sure you give your information when you're out and about so we can immediately get hold of you. Now, happy to take any questions.
Dr. Young, over the weekend you mentioned those positive sewage test results.
Yes.
How soon, we've got 4,000 people tested overnight. I'm sure you'd like to see more people tested to be sure that there isn't undetected active COVID. What kind of testing levels are you hoping for, and what sort of time frame do you think before we see positive tests if there is undetected COVID in those locations?
There's a lot of questions and a lot of hypotheticals there. Right, sewage testing just gives us an idea. It doesn't give us absolutes. So it says that there is virus detected in that sewage area. We don't know whether that's fresh virus, a new case, or a case that's still developing, or whether it's an old case that's still shedding. My concern is that we've not seen 4 areas simultaneously test positive like that before, and we do know that there are people who've previously been in the northern beaches that are in those areas. That's why they're concerning. But we can't link the two exactly. It just alerts us that those areas were negative and now they're positive. So something's happened. So really it's about anyone in those areas coming forward if they've got any symptoms, or anyone who's been in the northern beaches 11th of December onwards comes forward and gets tested. So there's not a direct link, but it is saying there's potentially a problem.
You mentioned those long testing lines today. We've seen them pretty much throughout the southeast. Previously, we've ramped up the capability with pop-up clinics and those drive-through clinics.
Yes.
Is that happening?
Yes. Yes, that's all happening now. The opening hours are being extended. They're getting more staff in. They're ramping up other clinics. All of that's happening. Yes.
What conditions would need to be met to reopen?
We'd have to have those 28 days of no unlinked case. So the good news at this point in time is all of the cases that New South Wales has announced, so they announced up to 83 this morning, have been linked back to that first event that happened in those 2 areas, those 2 venues, on the 11th of December. So at the moment they're all linked back.
Can I clarify just one thing? So that anyone who's been to the northern beaches, who's already in Queensland since Friday the 11th, they're being urged to go and get a test, self-isolate for 2 weeks?
It depends on the date they came in. So anyone who's having a test needs to isolate till they get the result. Now, some of those people might already be in quarantine because of the dates they travelled into Queensland. They then have to stay for the 14 days.
And then anybody who's travelling back to Queensland since 1 a.m. last night and 1 a.m. tonight, who've been in the Greater Sydney region, they also need to get a test and self-isolate for 14 days since being in that area.
They're Queenslanders who came into Queensland from 1 a.m. this morning. They have until 1 a.m. tomorrow morning to be able to do their quarantine at home, if their home is suitable, of course. After that, it doesn't matter whether you're a Queenslander or a non-Queenslander, you will have to go into hotel quarantine. Having said that, if you're not a Queenslander, you'll need an exemption to come into the state.
So we've had questions from people who returned prior to 1 a.m. last night, have also been in Greater Sydney. Their advice that they were given was to go and get a test, but then they only needed to self-isolate until the test was negative.
That's correct.
So
yes.
1 a.m. was the cut-off for
Yes.
a 2-week quarantine?
Yes, that's correct.
Okay.
Well, 2 weeks from when they left Greater Sydney. So if they went from Greater Sydney to the northern coast of New South Wales for a week for a holiday and then came up, they only have to go into home quarantine for a week. So they're being given orders, so they were told that they needed to go and get an order, and that would tell them how long.
But if someone returned from Greater Sydney, say yesterday, they only need to get a test and isolate until the test is negative.
Correct.
Yesterday, I think there were 15 close contacts in Queensland of New South Wales cases. Has that number been updated?
Yes, so there have been 27 close contacts that New South Wales have let us know about. One of them was that individual, of course, that we found here and has gone home. So that leaves 26 who are still in the state. All 26 are in quarantine. Some of them are in hotel quarantine, some of them are in home quarantine, and 20 of them so far have been tested and had a negative result.
Will the requirement for that digital check-in platform for businesses be written into a new health order?
Yes, it will.
And so that'll be from
Wednesday. Yes.
So the health minister will talk about that in a moment. We might let Dr Young go to AHPPC if that's okay. I'll hand over to the Deputy Commissioner. Thank you, Dr Young.
Thank you.
Thanks, Premier. So if I could just start with giving you some idea of the magnitude of the task we have at hand. Since Friday, when we brought back the border declaration passes, we've had 237,500 of those applied for, which gives you the indication of how many people want to come into the state from New South Wales. And since Friday, we've put over 500 people into quarantine. Just today, we've seen 6 flights come out of Sydney into Brisbane until just before lunchtime, and 166 of those persons had to be placed into quarantine. So we're seeing fairly significant numbers of people still coming into the state. The domestic borders, the domestic airports are working quite well because we're doing 100% meeting of all of the flights coming out of Sydney, so we're processing that quite well. Where we have concerns is at our road borders. And I'm briefed that even today, with not hard closures but with checkpoints, that we're seeing delays of up to 75 minutes and the traffic is very heavy. Also, during the period we've been doing random intercepts, we've turned around 81 persons and placed 112 into quarantine, and that was up till about 10:30 this morning. What's concerning about that is a number of those persons that were intercepted were either displaying the incorrect pass or no pass at all, and we're making it very clear that they were trying to get into Queensland to meet with family for Christmas purposes. So we can't give the community confidence that we are picking everyone up as it is coming across the border, hence the need to move to a harder border closure. So what people can expect to see commencing immediately is the reinstigation of our hard border closures across all of our road entry points with New South Wales, and progressively they'll be implemented and will be fully functional by 6 a.m. tomorrow. Please, everyone that wants to come into Queensland, please have the correct border declaration pass, and please identify whether you're coming out of the hotspot area. There are significant penalties that go with this. It's a $4,003 fine for falsely declaring, and it will be mandatory quarantine or turned around. So we really need people to cooperate with us here. We are trying to stop the spread of the virus again into our state, and it's disappointing that we've seen the instance where we've tried to do a system where it relies on the integrity and honesty of the community coming in, and some people are not doing the right thing. So therefore we have to go back to that more harder closure. I've high confidence in our people. They're well practiced at it. We know how to do this. We will do it as effectively as we can. We will always work with compassion, using communication to make sure that we do get our compliance with the people. But I just have to remind everyone that there are severe penalties if they don't do the right thing. Thanks, Premier.
The 81 people who were turned around, what period of time is that in?
That's from 1 a.m. this morning.
Oh, okay. And do you think that they were deliberately trying to...
I have no doubt the number of those people are deliberately trying to get in the state without having... They did not have passes, some of these people, or they had the incorrect pass, knowing that they should have had a hotspot pass rather than a G pass.
And have you fined them, or have they been just turned around?
At this stage, because we're doing random steps, we're doing turnarounds, but we will take a much harder posture if people continue to do the right thing, the wrong thing, I should say.
Will police be monitoring those people that have gone into home quarantine? So people that, there's obviously
Yeah, and I mentioned that yesterday. Since then, we've had another couple of breaches of that, so we're now up to 4 people that have failed to abide by their home quarantine orders. What that means for them is a $1,300 fine, a $1,330 fine to be precise, and also they are then placed in government hotel quarantine.
So these people who you've gone to check if they're at this house or the home or the place they're meant to be staying and they're not there?
Yeah, that's 100% right. Or they've done things like gone for a walk on the beach when they can't do that kind of thing. They need to understand, people that are in home quarantine need to understand we will check them. They will be checked. Not only will they have phone calls from our compliance teams online, they will get physically checked by police officers, and we will take action if they're not doing the right thing. Thank you.
Thank you. Beck?
Thank you, Premier. And as far as checking those individuals, when they make statements that they've been to a medical centre or somewhere else, the police are able to investigate to see the accuracy of those statements. So we warn people giving false statements to police could end up being a very costly exercise for them because they are able to be followed up and investigated and checked whether they have actually been at those places. So as the Chief Health Officer said, we've had 27 people now that New South Wales has identified as close contacts of positive cases in New South Wales, particularly Northern Beaches. We're very pleased that all of those people, other than the one who's already returned back to New South Wales, are all in quarantine, and so far the results of 20 of them come back negative. Of course, they still will need to be in quarantine for the 14 days, and they will be tested later in the 14-day period as well to check that they're still negative. As far as the compliance, we will be ensuring from 1 a.m. Wednesday morning that venues move to electronic records. Now, when we say electronic records, what we're talking about is whether it's a QR code or some other electronic means to ensure that if Queensland Health needs to walk into a business and get immediate access to the data of who has been there on any given day, that they're able to do that. So how that business collects that data electronically so that we're able to download it, we're working with businesses and stakeholders as to how they manage that. We know clubs and OSLs have their own check-in systems with members, often using driver's licences. So we want to be flexible, but what we are absolutely intending on doing is moving away from a paper-based system where Queensland Health are provided with paper sheets with eligible writing and names. And can I say, for those people who think it's funny to actually give false names and false details, if we need to put in place penalties for those people who are deliberately giving false information in their electronic records, then we will do so, because this is not a joke. We are trying to save lives here. So we want to make sure that people are giving accurate information, their name, their email, their phone number, when they're putting their information into either a QR code or other measures. We're also looking at how to make that electronic means easier. I'm working with business to do that. So a directive will be issued shortly by the Chief Health Officer that clearly indicates when scanning needs to occur and how. But the scanning is just one part. And as I said yesterday, I remind businesses and I remind people in Queensland, so patrons, customers, it is all our responsibility to do the right thing. So when you walk into a venue, do not sit down until you know you have scanned in. As a business, please be checking with your customers, your patrons, making sure they've scanned in. Don't leave it to chance because it is so important that we've got everyone's data. I want to thank everyone who's coming out to be tested today. We are seeing lines on the Gold Coast, Noosa and Brisbane of people lining up for testing. We know that they're waiting for some time. We have surge capacity and we're working across our hospital and health services to make sure they can work through those numbers, but there will be lines. And we are so grateful that people are coming out and getting tested. We want to keep doing that. So whether you've been from Greater Sydney, whether you've been from Northern Beaches, or you have symptoms that align with COVID, we want you to get tested wherever you are in Queensland, because that's how we can make sure that everyone stays safe. So please get tested and wait at home until you get those results And obviously, if you're positive, Queensland Health will contact you to manage those cases. But so far, we do not have any locally acquired cases in Queensland right now, and that's the way we want to keep it, but we can only do that if everyone plays their part. For those from New South Wales, from Greater Sydney and Northern Beaches who are hoping to holiday up here, we do want you to come when the time is right and when we can open back up to Greater New South Wales. But at the moment, we need you to follow the advice of the New South Wales Government and also Queensland, and please not come and make sure that you're getting those proper border passes and you are not trying to come here from a hotspot. The last thing is, please make sure if you're seeking to travel or you're returning as Queensland residents, please keep checking the New South Wales and the Queensland COVID sites to see if the hotspots change. We know there's other areas being looked at, and there is a possibility. There's 32 local government areas currently on the New South Wales and Queensland site declared as hotspots. So please make sure you're checking to see if there's any increases in those local government areas, so you will know whether you're eligible or not to come into Queensland. Any questions?
Can I ask, Minister, with the 28 days that the Chief Health Officer said is the benchmark again, what's the date that begins?
We can advise that we will not be reopening back to the Northern Beaches or Greater Sydney before the 8th of January. On the 8th of January, we will review, but the 8th of January is 28 days from an unlinked case being back to 11th December. So for the tourist operators and those who are relying on people coming from those areas, we do want to give you some certainty in saying do not expect any change before the 8th of January, and we will re-evaluate at that time based on what is happening in New South Wales.
Just on the QR codes and businesses doing the right thing, should they maybe introduce scanning or looking at IDs like nightclubs do, so that people can't give false names?
Look, we need to be practical about how we do this. We want people to be scanning in. We want businesses to participate in this process. We don't want to make it too cumbersome that they can't do it. We know that sort of equipment requires new equipment being put into venues. It comes at a cost. So the QR code is a very simple process. You can, obviously the code is displayed in a venue, in a cafe, restaurant. People simply open up their camera and hit the link and put their details in. So it's a really simple process that doesn't require additional cost or significant cost for the business. So we think that's the simplest process. I've Googled it. If you Google free QR code, you will find as a business that there are a number of platforms that allow you to set it up for free, and it shows you how to do it. So we think that's the simplest process so far. So we have 20 compliance teams out right now looking at just general compliance with COVID-safe plans and directives. So aside from the QR code or other electronic scanning, we want to make sure that businesses are complying with their COVID-safe plans and the directives that have been issued by the Chief Health Officer. So those compliance teams are out across Queensland today and will continue over the school holiday period to make sure there's compliance. That's in addition to the normal compliance by the Queensland Police Service and also the Office of Liquor and Gaming, where they go out and do general compliance as well. So they will be checking normal COVID-safe plans and compliance, but when we shift over to electronic, they will also be checking on that. We're not looking at a big stick approach here. We want to work with business. We want to work with stakeholders. It's education, it's warning, but our tolerance will only last for so long because we do need to make sure that we have accurate records, and if we need to, we will start fining businesses.
Are there any plans for the government to introduce its own check-in system like the other states are doing?
Yeah, so we are looking at that right now. Anything we can do to help small business and make it easier to have these scanning measures in place, we are looking at right now to support them.
So what agencies will be responsible from the 72 hours?
So it's a multi-agency approach. but it's the compliance team. So whether the compliance teams are coming from the Queensland Police Service, whether they're coming from liquor or gaming, in the past we've used environmental health officers from local government as well. So we have a range of compliance officers across government agencies that we will be using to undertake that work.
And do you have any idea of how many businesses or venues or cafes that you want to be checking on come this deadline?
No, what we'll do is we'll allow the compliance officers to go do their job. As I say, there's 20 teams out across Queensland today, and what businesses should expect is they could turn up at any time of day, any day of the week, so they could expect a visit. So we call on all businesses to make sure they're doing their bit to comply.
Premier, yesterday you mentioned that if cases continue in New South Wales that there could be cause for a national quarantine. We've had fewer cases today, which is very good news.
Yeah.
What's your latest thought about national quarantine?
Well, I just think we just need to monitor it carefully, and you know, if we do see an escalation, then I think the Prime Minister can call it. He's got the capability of doing that. Yeah.
And your Victorian counterpart Dan Andrews said yesterday he was worried about New South Wales not introducing mandatory masks or mandatory stay-at-home orders. He said that was one of the reasons why Victoria had put in the strong border controls. What are your thoughts about those?
Well, I think we all have to learn from what's happened in other states, and if that was very essential and part of the great outcome we saw in Victoria, then I think that every state should look at that as well in terms of if they had an outbreak. Yeah. Okay. Last one.
We're probably about another year away from a vaccine. Is what we're doing the best way to deal with?
No, not a year, because I think we've been hearing that from recollection. I think it was like March or April. They were looking at rolling it out here, starting the rollout here in Australia. Yep.
Well, is this the best way? These sort of closures to hotspots. Is this how we're going to deal with COVID outbreaks?
Until there is a vaccine that is widely disseminated again through the community. But I think what you've seen is a lot of the states and territories are talking to each other at the moment as well, and in terms of taking action, it actually stops the spread, and that's what we want to do. We want to contain where there is outbreaks, we want to stop the spread, and we want to keep Queenslanders safe. So that's my job, that's what everyone here is working towards, and we're taking the best medical advice, and we're also taking the best operational advice with the hard border closure, because we are seeing people breaching. And all you need is a couple of people to come into Queensland who've breached with COVID, and then we have community transmission. And Queensland at this stage has not had community transmission for 97 days. And that's a record that, you know, we don't want to see broken. Okay.
Thank you.
Yep, last question. Yep.
Just with the hard border closures at that time tomorrow, can Queenslanders still drive back in? Is that the line?
Queenslanders can come back in, but they'll be subject to the hotel quarantine after 1 a.m. tomorrow morning.
We're just having a look on the website now. It's saying if you select the if you're not flying in, it's saying that you need an exemption. Is that the case?
We'll come back to you on that one. I'm pretty certain that the way we prefer people to come back is by flight. The direction will be very clear about it. So the best thing that people can do is when they get into the Border Declaration Pass, it will take them through a series of questions. It will automatically work out what pass they should get and provide them with what the conditions of the entry are. So they need to be very careful to make sure that they fill that out appropriately, and that should answer all their questions. Thank you.